Welcome to This Explainer, where we're diving deep into the hidden reality of whiplash-associated disorders. We're going to break down everything from those violent milliseconds of physical impact all the way to the years of complex recovery that can follow. You might think of a whiplash injury as just a minor inconvenience after a fender bender, maybe a sore neck for a few days, right? Well, the science actually tells a remarkably different and honestly deeply fascinating story. Here is our roadmap for today. We'll start by unpacking the hidden whiplash epidemic, then slow down time to look at the exact milliseconds of impact. After that, we'll dive into the unseen damage it causes, review some modern treatments, and finally, wrap up with highly practical ways to protect your neck. Section 1. The hidden whiplash epidemic. So, you might think of whiplash as just a temporary sore neck, but the reality? It represents a massive and often totally invisible public health crisis. The global incidence is astonishing, peaking at 325 per 100,000 people in places like the Netherlands. But it's the long-term data that will really blow your mind. Nearly 40% of patients report lingering symptoms even 7 years post-injury. Just think about that for a second. 7 years. This drives an annual economic burden of over $3.9 billion in the United States alone. And that figure absolutely explodes to over $29 billion when you start factoring in legal and litigation costs. Plus, it's a condition that disproportionately affects certain demographics. Research shows that women are actually 1.5 to 4 times more likely to develop chronic pain from whiplash than men. Looking at how people actually recover reveals a pretty stark split reality. While half of people bounce back relatively quickly, usually within 3 to 6 months, the other half really suffer from lingering issues. A quarter of patients experience mild, persistent disability, and another quarter face moderate to severe chronic disability. So healing from this isn't just about waiting for pulled muscle to stop aching, it's an incredibly complex process. Section 2. Milliseconds of impact. Let's zoom all the way into the terrifying adrenaline-pumping speed of a rear-end collision. We're going to slow down time to look at what happens in less than half a second. In that tiny window, your cervical spine is violently forced through 4 distinct phases, generating shearing and compressive forces that human anatomy was simply not designed to withstand. Think of your spine as a slender column supporting the heavy mass of your head. When a car hits you from behind, the seatback drives your torso forward, but because of inertia, your head stays exactly where it is. This triggers the S-shape buckling phase, followed by a C-shape full extension, a violent deceleration, and finally a hyperflexion phase where the head whips forward, usually stopped abruptly by your seatbelt. Now, what's truly terrifying here is that the most severe structural damage happens right in the first 100 milliseconds, long before your brain even registers that a crash has occurred. In this S-shaped phase, the lower cervical segments, specifically around the C5, C6, and C7 vertebrae, extend while the upper spine initially flexes. This creates an extreme rotational torque. Basically, it's squashing and sharing your joints simultaneously. Section 3. The unseen damage. But what exactly is being damaged inside the neck during those violent milliseconds to cause such prolonged suffering? Because so often acute clinical imaging, like X-rays, will show absolutely no broken bones, leaving patients feeling like their pain is completely invisible. Now, if basic ligaments and muscles can heal over a few months, we really have to ask ourselves why so many individuals suffer from debilitating chronic pain years after that initial crash. Well, the answer is that whiplash isn't just one injury. It is a profound disruption of the nervous system, your articular joints, and connective tissues. The answer really lies in the profound contrast between localized physical tissue damage and complex neuropsychological alterations. On the structural side, we've got damage to the facet joints, which are the primary source of pain in about 60% of chronic sufferers. The anterior longitudinal ligament and the C5-C6 discs can tear, and they lack the rich blood supply needed to heal properly. But that physical damage is only half the story. The brain responds with its own form of trauma. Psychological stressors like perceived injustice, which is a patient's profound sense of unfairness and blame regarding the crash, are incredibly potent predictors of poor outcomes. This mindset actually fuels post-traumatic stress symptoms and can completely derail someone from returning to work. And this perfectly explains why chronic sufferers experience really bizarre symptoms, like pain from a light touch or a sudden intolerance to loud noises. Their central nervous system has become completely hyperreactive. This is a condition called central sensitization. The brain and spinal cord literally amplify neural signaling.
So if you have a patient whose pain response is wildly disproportionate to a physical touch, or who experiences widespread hypersensitivity even far away from the neck, they aren't making it up. Their nervous system has quite literally been rewired to remain in a permanent state of high alert.
Section 4. Modern treatment and guidelines.
With such complex, unseen damage, how are modern medical professionals actually fixing this? Over the last 2 decades, rehabilitation science has drastically shifted its approach. Clinicians first assess the severity using the Quebec Task Force grades. This provides a really clear roadmap, starting from grade 1, which features simple stiffness, all the way up to grade 4, which involves serious fractures. Modern guidelines recommend using screening tools by day 7 post-injury to predict the risk of a poor recovery. It turns out if someone is low risk, the absolute best thing to do is keep it simple, so we don't over-medicalize their condition and cause unnecessary anxiety.
Let's bust a major clinical myth right now. Passive treatments, like resting in those soft foam collars, are out, while active, psychologically informed movements are definitively in. The World Physiotherapy Guidelines, which were developed through rigorous global reviews, give strong recommendations against invasive injections, surgery, and passive immobilization. Instead, the things that actually drive recovery are treatments like targeted education, neck-specific exercise, and cognitive behavioral therapy.
Modern rehabilitation is an active, structured, 3-phase process that specifically targets the deep neck flexors and actively recalibrates the nervous system over a 12-week period. See, post-trauma, the deep, stabilizing muscles of your neck often become incredibly weak. It's kind of like the foundation of a house crumbling, which forces the superficial muscles, like your upper traps, to take over and do a job they simply weren't designed for. This creates a vicious cycle of tension. Physiotherapists work to restore those deep flexors, and for the nearly 30% of patients who experience dizziness, they implement sensory motor training, like eye-head coordination and balance drills, to fix those disrupted signals between the neck and the brain.
Section 5. Protecting your neck.
Finally, let's explore how you can take immediate action to prevent this traumatic sequence from happening to you in the first place, because the best treatment for whiplash? Avoiding it entirely. Modern dynamic systems like Volvo's Whips automatically cradle your torso and head during an impact, offering far more protection than unadjusted manual headrests. You know, a lot of people think of that thing behind their head as a headrest for sleeping, but it's actually a vital safety device called a head restraint. Dynamic systems use a pressure plate in the seat back. When your torso is thrown backward in a crash, the system leverages that force to instantly move the head restraint up and forward, catching your head before that dangerous S-shaped curve can ever form.
If your car has manual restraints, you must adjust them today. You want to keep the top level with your ears and ensure the pad is no more than 2 inches from the back of your head. Studies show that a properly adjusted head restraint can reduce the incidence of whiplash by as much as 40%. Yet sadly, research also shows most drivers leave their restraints fully down at the lowest setting, completely neutralizing their protective benefits. Also, make sure to keep that seat back relatively upright. If you're driving heavily reclined, the restraint is simply too far away to catch your head in time. I'll leave you with this final, provocative thought to ponder. Next time you get in your car, ask yourself, is your seat ready to catch you? Taking just a few seconds to adjust your head restraint today could literally save you years of invisible pain tomorrow. We've seen the hidden epidemic, the terrifying milliseconds of structural damage, the neurological toll, and the modern pathways to recovery. Now the power is completely in your hands to protect yourself. Thank you so much for joining me on this deep dive into the science of whiplash.